Gum disease is one of the most common health problems in the United States. According to the Centers for Disease Control, nearly half of Americans over 30 have advanced form of the disease known as periodontitis. Millions more have the milder form of gum disease known as gingivitis. And most people don't even realize they have the infection causing the disease. In the beginning, symptoms can be slight, a little bleeding when you brush your teeth, or puffy gums. But if not addressed in the early stages, periodontal disease can lead to lost teeth, receding gums, and chronic bad breath.
Before the perio trays, my mouth was just, every time I would brush my teeth, the sink would just be full of blood. It was uncomfortable. I probably had terrible breath.
Before I started using Perio Protect, I would bleed almost every time I brushed and or flossed.
So what exactly is gum or periodontal disease, and what can you do about it? Between your teeth and gums is a small valley called the sulcus, or periodontal pocket. In healthy gum tissue, it's only 1 to 3 millimeters deep. Brushing and flossing usually can keep this area clean and healthy. Your body also helps to keep this pocket clean. There are special cells in the sulcus that form a saliva-like fluid that flows out of the pocket. The fluid is called crevicular flow. If food, bacteria, or tartar build up in this area, a community of bacteria called a biofilm form and can cause an infection. This biofilm is a resilient community of infectious bacteria and is difficult to remove. Signs of gum infection include bleeding gums that can be swollen, red, and tender. Your teeth may become sensitive. Many people with gum disease have chronic bad breath. Unfortunately, it is very hard to manage this disease at home.
I had issues with my gums bleeding for a long time, even though I took very good care of my teeth, brushed and flossed and did everything right. I still didn't have that under control.
The problem with toothbrushes, rinses, and flosses is that they work on the surface. They do not work below the gum line.
We know that toothbrushing and flossing is just not enough, especially when you've gotten to the point where there's some disease present in the mouth.
If not treated, your infection can get worse. The fibers that support the gums break down, bone deteriorates, and many people lose teeth. Not only do these losses affect your ability to chew, they can also affect your quality of life, your ability to enjoy certain foods, and the appearance of your smile.
It's rough when you have like the gum diseases and all that, and you're like, oh my gosh, am I gonna lose my tooth?
If I live to be 100, I want my teeth to be 100.
I wanted to gain a healthy mouth. I wanted to be able to treat any of the periodontal disease going on and get a good healthy gums and keep my teeth in my head.
That's the main thrust of this whole thing, is keeping your teeth.
Research studies have also discovered an association between infected gums and other dangerous health conditions.
The problem does not stay here, because once you begin to erode the gum tissue, then the bacteria can get into the host bloodstream. There's research that shows if you just have an infected bleeding gums, you will increase those toxin levels in your bloodstream 400%.
You want to live longer and be healthy those extra years. You got to take care of your gums. There's so much that's out there now in studies showing that your gums matter so much more than anybody ever thought.
If you begin to think of periodontal disease then as an open wound, now it makes better sense to understand how these bacteria from this open wound can get into the bloodstream and how the oral disease can start to be related to systemic disease.
If your cheeks bled every day and were infected, would you just ignore it? How about the bottom of your feet? Gum infections need treatment too. The standard cleaning procedure in the dental office removes biofilms, but the bacterial communities reform in a matter of hours, and the infectious cycle can continue. Dentists have discovered one of the most effective ways to treat these infections is to combine in-office procedures with Perio Protect Tray delivery of medication.
The tray is a delivery device. The tray is like a syringe that delivers insulin for a diabetic. It's the insulin that helps the diabetic. The tray just delivers the doctor-selected medication down into and holds it in that infected area long enough for the medicine to work.
Patients use the tray at home on a regular basis.
They're flexible. You don't really feel them that much. You know, the suction's really tight whenever you put them in your mouth, so they don't like swish around or anything.
No discomfort. They're just there.
They are so flexible.
It's very comfortable and very relaxing, so you don't even know you have the trays in.
The specially designed prescription Perio Protect Tray is custom made for your mouth to deliver medication into the pocket at the site of the infection. The design of the Perio Tray prevents crevicular flow from washing away the medications. This gives the medicine time to break down the biofilm and fight the bacterial infection. Research shows that the medication held in place with the Perio Tray reduces harmful bacteria and significantly improves gingival health, including a decrease in bleeding gums and healthier pocket measures.
And I'm happy to say that since I started using Perio Protect, I haven't had any bleeding whatsoever.
With the Perio, I find that there is very little bleeding.
No more infection, no more bleeding of the gums.
After I started using it, things started going back to normal, and I feel much better.
And now my teeth don't bleed, they don't hurt, and the gums are really tight.
My pockets are they're great. They're like really not deep anymore.
My numbers are better. My gums look healthier, and I don't have any bleeding.
And now my gums are good. They're great, actually.
By using the trays, there was no mention of having oral surgery ever since then.
My implant doesn't hurt anymore. It used to hurt.
Teeth that were like sensitive, they weren't like so sensitive to me anymore.
I noticed improvement almost immediately, and now, after having used the trays for many years, I have very, very healthy gums.
While a serious medical condition, your periodontal disease does not have to diminish your quality of life. The Perio Protect system has been used by tens of thousands to manage the bacteria-causing gum disease, leading to healthier gums and patients keeping their teeth while enjoying fresher breath and whiter teeth.
Your teeth feel good. They're clean. They're bright. They're just fresh.
You know, I can smile without being self-conscious.
Smile a lot more now than I used to.
I would say it has changed my life because I've always had issues with my teeth.
But I'm 68 years old. I've still got all my teeth.
Don't hesitate to ask your dentist or hygienist about your own condition or anything you have heard here, so that you can make the best treatment choice and better manage your periodontal disease.
I really believe that I would not have my teeth if it wasn't for the trays.
I am absolutely convinced without them I would not have teeth in my mouth today.